Hey, everybody, welcome back to another episode of Casual Conversations. I'm your host, John Malanca, with my colleagues, Dr. Jordan Tishler, Dr. Adam Abodeely, and Dr. Sandra Carrillo. Welcome all, and thank you for joining us. Topic this evening comes up quite a bit. We get some questions, and so for our listeners and our followers, thank you for submitting these questions because it does help us get the message out to you. The topic this evening is cannabis, medical cannabis, and youth and children. Is it beneficial? Is it too young? When do you use it? When do you recommend it? And so let's start with you, Dr. Tishler. I know you work with a lot of, you all do, but pediatric patients.
Yeah, I think that this is a very interesting topic. It's unfortunately very loaded, particularly in the United States. There's a lot of people saying, oh, we got to protect the children from cannabis. I'm not saying they're wrong, but it also then migrates into things like we can't use cannabis when it would be appropriate. And so we really have to think about the question in, children and adolescents, young adults, sort of, in the sub 25-year-old category. When is it appropriate? Not whether it's appropriate, but when is it appropriate? And, certainly in children who have terminal illness, that's a time when this would be a reasonable thing to resort to. Certainly we see children who are differently abled and perhaps have dense autism and whose cognitive development is unlikely to mature. And in those folks, they develop symptoms that may be self-injurious behavior or other OCD-like phenomena that we can treat with cannabis. So again, contrast that to the call sometimes I get from mom saying, I would like you to prescribe cannabis for my son. He's 15 years old and he has some test-taking anxiety in high school, and can you treat him? And then I think, look, the kid's going to develop hopefully into a normal mentating adult. This is not the first-line therapy. Let's try some behavioral therapy. Let's try maybe some SSRI or other conventional meds, and then we'll see where we are.
Yeah. That's one thing, you talking about mom giving you a call. Cannabis is not a one size fits all. And if it works for one child, it might not work for the other. You're about it. What are we now? Cannabinoids, 160 plus or minus cannabinoids out there. They all play a role. THC, everyone thinks one, it's addictive, or I don't want my child high. And so that's why we do these casual conversations, to understand and educate and pay it forward on the education that's out there. Dr. Carrillo, I know you also work with children and families. Would you like to add to that?
Yes, sure. Definitely. We know that the only medication approved by FDA is the Epidiolex, that is cannabidiol, and it was precisely approved for refractory epilepsies in children. So it is one of the indications. And when we talk about, is cannabis bad for children? I mean, we have to know, as you mentioned, John, that cannabis is a plant with thousands of compounds, 160 cannabinoids. So let's talk by the name. We're talking about CBD, we're talking about THC, and what are the indication of these cannabinoids, particularly when refractory epilepsy. There is a lot of scientific evidence, very well backed up studies done and got the approval with FDA for treating particularly children with refractory epilepsies, such as Dravet syndrome, Lennox-Gastaut, tuberous sclerosis. So there's no discussion in there. When we talk, as Jordan says, palliative care, of course, we will be talking about different cannabinoids, but definitely this is like a use that there is a lot of stigma still between some families, between some parents, but definitely we have to be able to offer to the patient this alternative when other alternatives are failing, or when the opioids are not enough, or when the opioids are causing a lot of side effects. So keep it in mind. And of course, it's always under prescription of doctors, physicians, very strict monitorization, because we're treating children. And there is other indications, such as like autism, as Jordan mentioned, that I've seen in the consultation, as Jordan mentioned, there is some parents that come and say, oh, my child is being like very disobedient and don't want to go to sleep. How many gummies of CBD can I give him? And I'm like, no, 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 no. This is not the way you do things. This has to be a proper diagnosis, a proper indication. And there is definitely different pathologies that they are not the election. Cannabinoids are not the election. So we have to be very responsible with where is the scientific evidence, what type of patient is. And of course, I always recommend to the patients to always see the doctors, because again, we're treating children, and we know about drug interactions and side effects, and the doctors are always aware about these interactions. So I think this is a very important subject to address today.
You mentioned gummies. I mean, we still receive calls that people of all ages, parents to the children, that want to try cannabis, but I don't want my loved one to smoke it. And when I explain, and I know this is probably, cannabis 101 for many, a lot of people still have the stigma that the only way you can ingest this plant is via smoking. And so now, as you were talking about Epidiolex, and other sublingual forms, it is a medicine. And so many doctors now have, I guess, educated themselves on the benefits of this plant. On dosing is important. You mentioned sensitivities, drug-to-drug interactions, as well as the ailment itself. Dr. Abodeely, I know you go back and forth from here in the U.S. as well as down to Jamaica working with patients. What are you seeing in either country?
Well, just to further expand upon what has previously been discussed, before I share with you my clinical experience working with children in cannabis, I'll start with you to share with you how I approach these individuals. And, the first thing is, just like any other treatment, we always have to talk about, well, what are the risks and potential side effects of any form of treatment? And I think that's something that I think is worth us at least all discussing on air here is, well, what are these risks? And the first thing I would say, as I share with any patients, no matter what age it is what are the general potential risks of cannabis? We talked about the risk of drug-drug interactions, but we also have to, of course, talk about the risk of dependency. We have to talk about the risk of cannabis use disorder, the potential for things like schizophrenic and maybe increased risk of depression, anxiety. Some of these studies that we have out there, we have some studies to potentially support this. We have some studies not supporting it. And so we're left with still a lot of kind of best clinical judgment, if you will. And of the other thing that we talk about is, well, what are some of the potential risks of use at a young age that are unique to this population? And again, that's where we talk about, well, is there a potential risk of decreased IQ, decreased intellect, decreased functioning performance? What are those risks? And again, we know that it can affect the developing brain. Well, what is the developing brain? Well, maybe 20, 21, as high as 25. I hear some people say 28 years old. So, I think it also brings the point, what is a kid and what are we really trying to avoid here? Well, we're trying to avoid any of the same risks that will occur with any population. And then we have to talk about the risks that may be unique to this population. That all relates to the developing brain. And of course, the potential social impact of using cannabis at a younger age, which then could affect your entire outcome in life, depending upon, your use, consumption, et cetera, et cetera. So going back to then how I use it to approach patients, well, my experience with younger patients has been in oncology and cancer. So again, from a palliative care standpoint, of course, I'm concerned about the potential risk for a schizophrenic event, and maybe potential drug-to-drug interaction? But am I concerned about the risk of, IQ? The example I can give you is an 8-year-old who was essentially given 3 to 6 months to live, who had metastatic kidney cancer and was looking for alternatives to their opioids, and the parents were interested. We had a discussion, and it was a coordinated effort, of course, between their primary care pediatrician oncologist and myself to make sure that cannabis fit into their program. And so in that case, it's palliative care, and I don't think there's many risks. The other population that I treat is largely as inflammatory bowel disease, and although I don't have tremendous amount of experience with young children, I do have a good deal of experience with teenagers. If we're considering the developing brain as high as 25 or 28 years old, then I definitely have a large amount of adults, which we would then have to put into the same category as being kids, because they're not legal kids, but they are developing brain kids, I guess. And so when I'm treating patients with inflammatory bowel disease, as I'm with any other, condition that I'm treating medically, if I'm going to use cannabis, it's with the hopes that it's going to mitigate the risks of other medications. It's going to potentially allow for the decreased consumption of other medications, which all have their risks. So with inflammatory bowel disease, if I'm seeing an adolescent who is on a biologic therapy, who's on chronic prednisone therapy, who's on chronic steroid use, who is on antispasmodics, these drugs come with a whole host of side effects, which we don't know, and we certainly potential effects of developing the developing brain. And so with cannabis, again, we have to use that, we have to use it with, weighing the risks versus the benefits. And so if I can work with an adolescent to get them off opioids, maybe get them off some steroids, get them on some less antispasmodics, well, in that case, then I say that, cannabis, is a useful tool. If it's the only tool that they want to use, then that's a very different conversation.
Yeah. Thank you for bringing up the risk. I know we kind of skated around it, but I'm glad you brought it back to, and that's what this conversation was about, is risk on the developing brain of a child. Jordan, would you like to add anything to this?
No, I was thinking that it might be interesting to veer slightly off the topic, or off the therapeutic topic, and talk also, to our primary care colleagues here, who may also not only be thinking about this as a therapeutic, which we hope they're thinking about, but in addition, they're seeing patients for whom this isn't a therapeutic, but they're telling them that they use it recreationally. So as an adolescent specialist or an internist or other adult practitioner talking to an 18-year-old or a 21-year-old who says, yeah, I'm smoking some weed, or I'm thinking about smoking some weed, although I can't imagine anyone actually saying I'm thinking about smoking some weed. But, so what do we tell our colleagues about how to approach that conversation?
Well, let me go back here, because I've run into this quite a bit. And so for our listeners, it's not illegal, even if you live in an illegal state, to ask the question. So I don't want you to be afraid about that. Trying to see you. Is that a pet there? Love it. Welcome to the show. But if you don't feel comfortable as a practitioner answering these questions, I'm certain you have someone in your Rolodex, especially today. And if not, you have 3 incredible doctors here that can ask. And so don't be afraid to go out and reach out to some of your colleagues that one may know the answer, but 2, if you feel uncomfortable to answer this, to be tied to medical cannabis and a child, please ask for help. Do you want to add to that, Adam?
No, I think there's a lot of discussions that are had around here, and things that are worth, discussing around this, topic, everything, including, having discussions with people about what has happened, the landscape of adolescent cannabis consumption, over the past 10, 15 years as more and more states have legalized it. And,
Yeah, well, definitely it's a challenge with the adolescents, and that's why we try to stay away of the term recreational, because that will give the wrong idea to precisely the adolescents, because we try to say adult use, and that will just frame it the right way. If it's adult use, will be like a decision that is informed by somebody who has the fully developed brain, that it will not go on the risks the adolescents go. But it's funny because in my clinical practice, I've seen a few times adolescents that come and bring the grandmother or the grandfather to the consultation, and they see the grandma is taking cannabinoids, and then they feel super confident and they come and tell me, oh, I'm smoking because this is medicinal. Grandma is taking it, so I take it because I feel relaxed. And I said, okay, this is not the right context, the way you're doing it, because your grandma is doing it under prescription, monitorized on the standardization products, and her brain is fully developed, and there is risks for adolescents, as we know. So definitely we need to change the narrative, and stop saying recreational, because we're sending like a wrong message. And I always say that in every country the medical cannabis is legalized, there should be like a very, very strong program of education at schools.
It's funny you say that. Here in California now we are adult use, where other states have called it recreational use. I personally voted no on it back then. I said, it's not that I don't want everyone to have access to it. I truly believe a doctor, a medical professional, should be involved. And what have we seen here in California? True medical practices have gone out of business. And you know what's up? ER visits, thinking that this tiny little something, oh, how could that be so powerful? Oh my God, I feel like I'm having a heart attack. And that's not only with the geriatrics as well as the pediatrics, that are, the parents are, and some patients are dosing themselves. Oh, I can do this. I'm not feeling anything. Let me take another one.
Both of you really hit on something that I think is really interesting in the terminology. Sandra, you mentioned that by calling it recreational, we're sort of giving kids the message that they should do it for fun, and I think that's a very interesting point. I have very much negative feelings about the term adult use, and we actually have a position paper in the association about this. Because the flip side is what you're saying, John, which is that when it's adult use, the idea, the messaging from the industry becomes, you're an adult, you don't need to go to the doctor, just come to us and we'll tell you what to do. And that shunts patients into this essentially recreational approach. So we've come to the conclusion that the best terminology is medical and non-medical. But I think adult use has really been adopted across the globe in a way that I think has actually been very destructive and has really played into the industry's desire to treat everybody like a recreational user and shunt traffic away from physicians who are obviously going to be in the position of saying, I want you to use this much, not this much, and that's not good from the industry's point of view. So getting the doctors out of this discussion actually has financial implications for certain of the industry players. So I think that continuing to use this adult use terminology is harmful, and I think we should revert back to medical and non-medical.
I'll let you start that campaign.
Well, as I said, we do have a position paper on that. If anybody's interested in thinking about it.
And you want to share a little more what the Association of Cannabinoid Specialists offers to medical professionals?
Yes, absolutely. Our goal is to provide education that is based on human evidence. And we do this by providing some free educational materials, a handbook of therapeutics, a curated library that we call the clinical reference library, all of the key studies that you should know right off the bat. And then we offer a bunch of deeper coursework introduction to cannabinoid medicine, which is really your soup to nuts. How do you get started in this field? As well as then a bunch of sort of 201 level deeper dives on specific topics like women's health, pediatrics, drug interactions, GI issues done by Dr. Abodeely, and others. So, and then on top of that, we're really focused on providing policy guidance to states and to the federal government and internationally to develop policies that are not purely recreational in their outcomes, but really do facilitate patient care as well as other goals. So you can find us on the web at www.cannaspecialist.org. That's www.cannaspecialist.org. And please consider joining us and lending your voice to our cause.
Great. And I'm going to add one thing before we sign off. The courses are accredited. So can you add that too, please?
That's absolutely right. The introduction to it, cannabinoid medicine is AMA Category 1 approved for 3 hours.
Wonderful. So, well, thank you, team, for another informative, casual conversation. We'll see you next time, and keep the questions coming. And I appreciate everything Dr. Jordan Tishler, Dr. Abodeely, Adam Abodeely, and Dr. Sandra Carrillo for joining in from the Casual Conversation and the Association of Cannabinoid Specialists. We'll see you next time. Have a great evening, everyone. Bye-bye.